Today we're going to talk about hepatitis B. Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic disease. Differentiation between different types of acute hepatitis began to appear in literature in the decades after World War II. In the 1950s, Dr. Bloomberg was researching the genetics of disease susceptibility when he came across an unusual antigen from a blood sample of an Australian Aborigine. Years later, in 1967, a different scientist, Krugman, published a groundbreaking paper with his colleagues which differentiated between various types of acute hepatitis, including one which they called serum hepatitis, which would later be identified as hepatitis B. Just 2 years after that, Dr. Bloomberg and Dr. Millman were able to use their unusual antigen to invent the hepatitis B vaccine. Although an effective vaccine has been made, hepatitis B remains prevalent throughout the world, and in some places, like sub-Saharan Africa and East Asia, up to 5 to 10% of the adult population is chronically infected. The hepatitis B virus is transmitted through contact with the blood or other bodily fluids of an infected person. This includes saliva, vaginal, and seminal fluids. The virus can survive outside the body for at least 7 days. During this time, the virus can still cause infection if it enters the body of a person who is not protected by the vaccine. Incubation times can vary between 30 and 180 days, with the average being about 75 days. Let's talk about symptoms. Most people do not experience any symptoms during the acute infection phase. However, some people have acute illness with symptoms that last several weeks, including jaundice, dark urine, extreme fatigue, nausea, vomiting, and abdominal pain. A small subset of persons with acute hepatitis can develop acute liver failure, which can lead to death. In some people, the hepatitis B virus can also cause a chronic liver infection that can later develop into cirrhosis of the liver or liver cancer. Chronic hepatitis is responsible for 80% of liver cancers. This is why, in 1969, when Bloomberg and Millman invented the vaccine, the FDA called it the first anti-cancer vaccine. In diagnosing hepatitis B, one must use laboratory tests to rule out other possible viral agents. The lab test aims at detecting the surface antigen HBsAg. The World Health Organization recommends that all blood donations are tested for hepatitis B to ensure blood safety and avoid accidental transmission to people who receive blood products. 90% of healthy adults who are infected with the hepatitis B virus will recover naturally within the first year. However, those with the persistence of the HBsAg antigen for at least 6 months are considered to be chronically infected and, as stated, at severe risk for developing liver cancer. The likelihood that infection with the virus becomes chronic depends upon the age at which a person becomes infected. Children less than 6 years of age who become infected with the hepatitis B virus are the most likely to develop chronic infections. To break it down a bit more, 80 to 90% of infants infected during the first year of life develop chronic infections. 30 to 50% of children infected before the age of 6 develop chronic infections. In adults, it's only 5% of otherwise healthy persons who are infected that will develop chronic infections. Let's take a look at treatment and prevention. The hepatitis B vaccine is the mainstay of hepatitis B prevention. The World Health Organization recommends that all infants receive the hepatitis B vaccine as soon as possible after birth, preferably within 24 hours. The birth dose should be followed up by 2 to 3 doses to complete the primary series. The completed vaccine series includes protective antibody levels in more than 95% of infants, children, and young adults. This protection lasts at least 20 years and is probably lifelong. Booster vaccines are recommended to people who frequently require blood or blood products, such as dialysis patients or recipients of solid organ transplants, frequent needle users, any household members or sexual partners of people with the chronic hepatitis B virus infection, and healthcare workers and others who might be exposed to blood and blood products through their work. In addition to the vaccine, implementation of blood safety strategies helps to protect against transmission.